Well, one of the first things I did in my first week was contact them to offer a meeting. We've reiterated that again today. I'm hoping to see them very soon. Obviously, we're keen to see what the result of the ballot was, but my door is open and I look forward to meeting them in the days ahead.
Now, they have voted for a strike, so this is not something that's ever happened before. Do you understand the depth of frustration amongst people who their business is caring for people? They don't take this action lightly.
Well, we hugely value the work that nurses do. That is why we've committed to the independent pay review body to accept their recommendations in full, £1,400 for over 1 million workers. We also last year recognised the contribution of nurses. That's why nurses received 3% more than most other public sector workers last year as well. And they themselves say there's a range of factors in addition to pay, and of course we'll be discussing that with them. But we also need to recognise that these are economically challenging times. We need a strong economy in order to pay for a strong healthcare system, and a demand of 17%, 3 times what most non-public sector workers will receive, is out of step with the economic circumstances that we face.
You say your door is open. Is there? These are people performing a vital function. Are you going to offer more?
Well, we'll obviously discuss with them in terms of the circumstances and the issues that they're raising, but we have an independent pay review body for a reason, to look at the issues in the round and the various circumstances. Of course, it's not just about pay, it's about our investment in the NHS estate. That's why we're committed to 40 new hospitals. It's about increasing the number of nurses. That's why we've got 9,000 more nurses this year than last year. We're also on track in terms of our manifesto, 30,000 more nurses to our 50,000 extra nurses target. It's about investing in tech and a wide range of things. But in terms of pay itself, we're offering an additional £1,400. What the trade union are demanding is 3 times what non-public sector workers will receive, an increase of 17,000. And of course, we have to be mindful of economic stability and ensuring that we have a strong economy, because that's the bedrock through which we invest in health, but also the other public services that we need.
And what about for patients? I mean, we know obviously that emergency services are going to be staffed, but what are you going to do to ensure people still get the care they need?
Well, it's important that we recognise firstly that emergency services will be staffed, and that's hugely important. In terms of the impact, this will vary from trust to trust. Not every trust supported the ballot action, so we need to look at our contingency planning, working with trusts, working with NHS England in terms of those impacts, and that's why, again, my door is open. I'll be having further discussions with them. There's a range of issues that they've raised, but the key issue is one of fairness. We've offered £1,400. We've accepted in full the recommendations of the independent pay review body. We gave an increase last year above what most other public sector workers received. And we also need to recognise the economic circumstances in which we currently face.
But what you've offered clearly hasn't settled this, so you need to do something that's going to change the situation, don't you?
Well, as I say, I think a demand of over 17%, a cost to the NHS of a further £9 billion in terms of the agenda for change, is out of step with the economic circumstances that we face. But at the same time, we recognise that nurses do a hugely important job, very much valued. That's why we're working closely to adopt in full the recommendations of the independent pay body. It's why we took the extra measures that we did last year. It's why we're investing in more nurses, 9,000 more nurses than last year. It's why we're investing in 40 new hospitals, because alongside pay, it's about our wider investment in the NHS, in its estate, in its technology, and the number of staff, alongside accepting the pay recommendations in terms of the offer to nurses.